You know, Hidalgo County is the 7th most populous county in Texas out of 254. And in a recent study by the federal government, they were trying to find out what counties in the United States had a poverty rate of 20% or more. Unfortunately, Starr County, Hidalgo County, Cameron County, and Willacy County made that list and have been in that list for 5 decades. So obviously we have a problem. And the problem is that we have a very high percentage of our people in poverty. And if you look at the statistics, many of those don't even have a high school education. Some have some high school, and so forth and so on. So I think if we're going to solve and be competitive in today's modern world, we're going to have to create human capital. And that's why all of us working together need to look at ourselves to solve the problem and not look at somebody else. Because if we look at somebody else, we've had a push down policy from the federal government and the state government, and it hasn't worked for 5 decades. So I don't know that if we continue to do the same thing, we would expect different results. So what we're doing here in Hidalgo County, we've formed a coalition of many institutions and individuals to try to identify the people that are living among us and create human capital, and then match it with a corresponding job. And of course, many of those jobs that are needed here, as you know, we have a low percentage of physicians and healthcare workers in this area, and we certainly need more. Hopefully with that, we can help fill in the gap.
Mr. Vela?
Yeah, thank you very much, and thank you for the invite to be here. I'm honored to be on the stage with these esteemed folks. I want to commend Judge Cortez, his leadership, the folks here in Hidalgo County, for being so proactive in regards to the Prosperity Task Force that was created here. A lot of counties, unfortunately, not ours down here, by the way, we're blessed to have 4 very solid county judges leading the charge for us, but there are other areas of the state that are not as blessed to have leadership, such as yours, Judge. And so thank you for all of the efforts that y'all are making. And I think really the key's already been touched on, and that's collaboration. Right? And in collaboration, I'm not referencing silos, just higher education collaborating with each other, even though Veronica and I have talked about this before. It's time for us to collaborate. It's not time to compete against anybody. We're not competing against anything other than poverty right now, right? So when we talk about collaboration, it's industry, it's government, it's the private institutions that surround us, all working together for the common cause of understanding, okay, where do we sit from a poverty perspective? What are the demands from an industry's perspective? And who's best suited to help train that particular component of workforce, right? I'll tell you, I think folks in this room can and should be proud. We're working with Region 1, we're working with TEA, we're working with our counties, we're working with our fellow private institutions and public institutions. We're sitting down to make sure we understand all of those dynamics. And quite honestly, as the saying goes, as goes South Texas, goes the rest of Texas, and perhaps even the country. I like our chances because of where we sit today and the commitment, the desire, and the ability to do all of those things simultaneously.
Ms. Veronica? Thank you, Rajmi, and thank you again also for inviting us. As I was listening to some of the earlier presentations, I thought, oh my gosh, I do government and community relations, and I may be out of my wheelhouse listening to some of the data on healthcare, but what I can tell you is we are in the business of making sure that we educate our children and make sure that they get into a good job, into the workforce, right? And we're doing that in many different ways, but I'm very proud that since UTRGV opened, our rankings show that we are top, not only in the state, but in the nation on social mobility, where a person starts to where they end up. And a lot of that has been because of the healthcare industry as well, and the jobs that have been created here. So we're seeing, we are developing programs, more and more programs, not just for physicians and nurses, which we know are needed all across the country, but all of the allied health industry, because we know that they have to work together in integrated care. They need to work, we need social workers as much as we need the physicians. We are starting a physical therapy program. We have occupational therapy. We're being flexible with online courses and accelerated courses, all of those things that are going to help to build a workforce. I'm also very proud that we all got together and many in the community to partner on what we're calling the Recompete Grant. And it's a federal grant that could even bring us as much as over $80 million. UTRGV has taken the lead on that one, but A&M is our partner on it, South Texas College, TSTC, TSC, the 4 counties, you name it. And what we're trying to do with that grant is to identify the jobs that are already out there and make sure we get people the credentials they need to get in those jobs, but also to identify the jobs that we need to get our EDCs and others involved so that we create those jobs and then bring the types of industry here that are going to place our students in that so that we don't lose the best and the brightest in the area, what we call the brain drain, and that we make sure that people are able to take care of their families and take care of them with good paying jobs.
Thank you. Kimberly? Yes, and I completely agree with what you're saying. At Western Governors University, we have kind of that same mission. You know, you're always looking at what do we need for our workforce? How do we help build the workforce? But I think one of those interesting things that a lot of higher education institutions do is they pull from the workforce to create the workforce. Well, for many people, that's impossible. You have families, you have individuals you're having to take care of, and to tell someone that they can't work while they're going to school to upskill to get this next degree is just not feasible, not to mention it's not helping the community at large, because again, we're creating a greater deficit. So really, I think it's looking at these innovative ways and these innovative pathways. What can we do to help grow the workforce where we need the workforce, and ensuring that they can work while joining and upskilling into that next effort? Because really, once we're doing that and we're changing that, you're really changing the entire community. You're really changing the entire family network, the population at whole. Because again, once the parents are getting that education, that's also going to their children, their children's children, and it continues to move. But again, a majority of those individuals have to work full time to attain those skills that they need. I think some of those things that are really interesting and what was brought up today is really looking at what we need to make healthcare equitable and affordable, and also to have that accountability. It was so interesting to hear so many individuals talking about the healthcare coordinators. And of course, that's even a degree that we have, knowing that there is a need for healthcare coordination. There is a need to move this all around, to have that home health and to work with that. So I think it really does take everybody. I agree, there should not be competition, because a one school doesn't fit every individual, one program doesn't fit every individual, one opportunity doesn't fit every individual. And that's where we really have to work together and realize that we all bring something different. And that might be the one thing that individual needs for success and to move forward and to grow within the workforce.